Hello, Dr. Arroyo. Can you hear me?
Okay, there we go.
All righty. I hope we didn't already go live. I was having some technical difficulties.
Okay, I'm glad to see you both here.
Good morning.
Hey.
Took me a little while to get off mute. Sorry.
You want to cue up your presentation?
Okay. Go slideshow. Hey, you can see my pointer.
I don't see. Oh,
Oh,
Share
hold on. Share screen. We went over this. Share.
perfect.
Here we
So
go.
you can stop sharing right now.
Okay, stop sharing right now.
Right, because then the two of you will be on the screen when we first start.
Okay. And
Yes. There's no join button yet, right? Okay, good.
Deirdre, there's like this popping sound coming out of my computer. I don't know if it has to do with Zoom and being signed in. You hear it too?
It's the chat. And I was
Okay.
trying to figure out, how do you mute the pop-ups? Like every time someone posts in the chat, you can hear it.
Okay.
So the chat is disabled.
While you're in a
Which
meeting. Well, no, it's actually from the virtual, like the floor. So anyone that chats in the group, like you can just see everyone's chat. So the pop-ups for the chat, it's like a popping sound, like you can just hear it in the background.
Okay, so did you close out everything except for Zoom?
No, I could try that.
Yeah, close everything out.
Thank you.
All right. And then I see that Kat left her camera on during the presentation, so maybe I could try and do that. If I'm like this, am I looking in the right direction?
Yes, you
okay. Okay. And then if I look, I have to look over here sometimes. But I think we'll be okay.
Hold on. I'm gonna turn my camera off first of all. And then when I mute, you should not be able to see me.
Oh, and Deirdre, just what is the end time that we're aiming for here?
It is 11:20, and I'll be able to send messages in the chat.
Okay.
But what I am not seeing is we're already recording. So I have a feeling when the join button pops up at exactly 10:50, we're gonna already be live.
Okay.
Okay.
Because I wasn't able to enter to see you until I hit start the webinar. But there's usually another one that says go live, and that one I do not see. Let me see.
Yeah, it looks like the live video on my end as well. It looks like the live session on my end as well.
Yeah. So we have 5 minutes. So you have your intro ready?
Yes.
Okay.
So once the presentation begins, do I just turn my camera off?
No, when the presentation begins, you can leave and then go watch it from the regular link.
Gotcha.
So she'll be the only one left on the screen, just like how Dr. Soaring is. And then remember, Jennifer, you're going to be closing it out. And then you could just say, thanks for joining me, you know, enjoy the rest of the summit, and please stop by the Siemens Healthineers booth.
Okay.
Could somebody put questions in the chat?
Yes.
No, I was having somebody put in a question for Dr. Soaring. Can you see where I typed in get ready?
Yeah.
Yes.
Did you see what I typed? Okay, so I'm going to mute myself, and when it's time to start, you know, right before, because I think it's going to just go live, and then I'll just put you can begin, and you'll be able to start with the introduction.
Okay. Thank you.
Yeah,
Thank you so much, teacher. Nice to meet you face to face, Dr. Arroyo.
You too, Shy.
And you can all hear me clearly, correct?
Yes.
Yes, very well.
Is somebody on the screen with her? Who? The other girl? Oh, Devin stayed on to ask questions. So if you want to do that, you can just turn your camera off and stay on. You want to do that instead? And then give her a few questions when she's finished?
Sure.
Or do you want to just do the questions and then just sign off?
I mean,
whatever's needed.
Yeah, I think I might be better off just reading the questions.
Okay.
Select the questions.
Just log off when you finish, Shy.
Okay. Like waiting. I saw a few people in the chat. They're here for you, so.
Oh, really?
One more minute.
Yay. Okay. Good morning and welcome. My name is Shai Townsend. I am a quality support operator at Siemens Healthineers, as well as a site lead in the Cary, North Carolina area for Siemens Healthineers employees of African diaspora. It is with great pleasure and honor to participate with Black Health Matters and Boston Scientific. Today's events display the equity commitments of Siemens Healthineers to engage the community on topics of health awareness and disparities. I will introduce our current session speaker, Dr. Jennifer Arroyo. Holding a PhD, Dr. Arroyo specializes at the top of her class in immunology, microbiology, and virology. In the last 7 years, she has been dedicated to developing immunoassays, which have a wide variety of clinical application. Dr. Arroyo most currently contributed to development of COVID-19 related tests, which allow for identification of patients who have developed an adaptive immune response indicating recent or prior infection. She will be leading us through our session, Dispelling Myths about COVID-19 Testing. Welcome, Dr. Arroyo.
Thank you, Shai, and thank you for that introduction. And I'd like to welcome all the participants who've joined on this Saturday morning to engage in these important health-related topics that are being discussed today. And thanks to Dr. Soring for that wonderful overview of COVID-19, as well as helping to highlight the importance of vaccination. So some examples of topics we're going to go over today are which types of tests are available and what do those tests measure? What do I do once I get my results? And what's the overall importance of testing? So I'm going to go ahead now and share my screen. All right, and can everyone see the screen? I hope so. All right, so why is COVID-19 testing valuable? Well, first off, it's valuable on a number of levels. It minimizes an individual's risk because once an individual knows they're infected, they can then seek medical guidance and medical intervention if necessary. Another thing it does is it informs action, meaning once a person knows that they're infected, they can then take measures to prevent spreading the disease to others. And the way this is done is by isolating, which means staying home, not going to work or visiting stores and friends, and also trying to limit as much as reasonably possible contact with others in the same home. So testing also helps to establish disease prevalence, and this is crucial for surveillance. So the data that's gathered by COVID-19 testing is necessary to get an understanding of what the infection rate is in specific areas. So are the number of cases increasing or are they decreasing? And this information can be used to inform policy decisions, such as do schools need to be remote? Can restaurants be open? Should an infusion of medical supplies be sent to specific locations, and so on? So testing also enables contact tracing. So once an individual knows that they've been infected, they can then inform their close contacts. And this is important because some of those close contacts that were infected may still be in the pre-symptomatic stage, meaning the virus is in their body, but they don't feel sick just yet. So they'll be out and about, carrying on their business as usual, visiting friends, going to work, and unknowingly spreading the virus. That is, unless they have information to advise them otherwise. And that information can come from contact tracing. It gives the contact a heads up that they should go and get tested and quarantined. And this puts the brakes on the spread of infection. So in the next slide, we're going to see just how significant applying those brakes can be. Sorry, I'm having a problem advancing the slide. There we go. All right. So this is a diagram that gives us a visual to understand infectious disease spread and how significant applying the brace can be. So let's envision that this individual here is unknowingly infected with COVID-19, meaning the virus is in their body, they're contagious, they can pass on the disease to others. However, they have no symptoms and they're unaware of all this. If this person infects just 2 other individuals, and those 2 individuals infect 2 others, and so on, what started off as 1 case being passed to 2 people has quickly multiplied into over 100 cases. But with COVID-19 testing and contact tracing, the scenario might play out differently. For example, let's imagine a friend he saw a day ago calls and lets him know that she tested positive for COVID. So now this person knows that he's been exposed and makes the wise decision to cancel dinner plans with his friend. Applying the brakes to just this 1 contact prevents all of these further cases of infection. So by using the information that we gained from COVID testing, each of us really has the power to make a significant impact on reducing the spread of disease. Now, having highly accurate tests is critical. So how do we know if a test is reliable? Well, this is where the terms sensitivity and specificity come into play. So the sensitivity of a test refers to the ability of that test to identify a person with a disease or marker as being positive. And the specificity of a test refers to the ability of a test to describe a person without the disease or without the marker as negative. Now, specificity, when we have very high levels of specificity, a test with a high level of specificity will rarely produce a false positive result. And tests with very high levels of sensitivity will rarely produce a false negative result. So early in the pandemic, you might have heard on the news that some of the tests that first came to market turned out to have low specificity and sensitivity. And tests with low specificity and sensitivity are problematic because they'll often produce inaccurate results. And such tests are no longer for sale on the US market. Now, of the tests that are on the market, some perform better than others. Some have higher levels of specificity, others have higher levels of sensitivity. And the FDA has approved, well, the FDA has authorized emergency use authorization has been granted to tests with very high levels of sensitivity and specificity. Okay, so what are the different types of tests that are available? On the news and commercials, we hear about antigen tests, PCR tests, rapid antigen tests, antibody tests. So we'll take a minute here to tease apart those tests and understand what kind of information and advantages each of those tests has to offer. So the first thing is, what category does a test fall into? Is it a viral test or an antibody test? So a viral test will detect some piece of the virus itself. So a positive result on a viral test indicates some current infection, meaning that the virus is present. While an antibody test, on the other hand, is a type of test that detects a person's immune response. So this could be an immune response that was generated due to a past infection or an immune response that was prompted by a vaccination. So these different types of tests use different sample types. Excuse me. The different types of tests use different sample types. And many viral tests use respiratory cells and fluid. And these are typically collected via nasal swabs or nasopharyngeal swabs. And an antibody test, on the other hand, require drawing blood from an individual to be used as a sample type. So what exactly are these tests detecting? What are they measuring? In the cases of a viral test, some of the tests are referred to as antigen tests. And these tests detect a protein component of the virus. So for example, the nucleocapsid, which is abbreviated as N protein here. And some of these antigen tests are rapid tests conducted right at the point of care, and they can produce results within, say, 15 to 30 minutes. So this means, for example, if you visit an urgent care for an antigen test, you might be able to expect results within 15 to 30 minutes of the swab being collected. Now, other viral tests detect the genetic material of the virus, and the genetic material of the virus is represented by this blue line here. So human cells have DNA, that's our genetic material, and that's the blueprints that our cells use. Well, COVID has something similar. It's not DNA, but it's a related molecule, RNA. And the virus contains this RNA, and when it infects our bodies and our cells, it uses the machinery of our cells to reproduce and make more of that viral RNA and viral protein so that new viruses can be produced. Well, tests that detect the genetic material of the virus, these are referred to as PCR tests, You'll also may hear them called RT-PCR tests or NAT tests, which stands for nucleic acid amplification tests. These tests the terms all refer to a test that detects the genetic material of the virus. And lab-based PCR tests are very sensitive. But since they're conducted in a lab, that means that a sample needs to be collected, shipped to a lab where the testing can be done. And the turnaround time is usually 1 to 3 days. A rapid antigen test, on the other hand, has a short turnaround time. And that allows for quick identification of infected individuals. So antigen tests and PCR tests can have comparable performance, but that depends on some factors, such as the timing of testing. And soon we'll take a look at how the timing of testing plays a role and why in some cases, after the antigen test is performed and a negative result is obtained, there's still a need to confirm the results with the PCR test. So antibody tests, these are types of tests that detect a person's immune response. So what they're actually detecting are antibodies that are produced by our human body in order to fight against infectious disease. So testing antibody levels can help inform long-term vaccination strategies and confirm vaccine effectiveness. So for example, some individuals who have specific blood cancers or who've had organ transplants, they may not respond to the vaccines like people without those underlying conditions. Therefore, doctors of such patients might order antibody tests to understand what type of immune response their patient has produced in response to vaccination. So testing for SARS-CoV-2 infection, as I said, there are types of tests. There's tests that detect if the virus is present, and these can be either a test that detects viral RNA or viral antigen. And then we also have tests that detect the immune response to a virus. So this can be an immune response to the virus or an immune response that's produced in response to a vaccination. All right, so how does the time course of infection guide our testing? Now we're going to take a look at this graph here to understand the time course of infection and how that relates to COVID testing. So at the top, there's 3 bars, which represent the types of tests we've discussed. The shades of orange represent antibody tests. Shades of blue represent molecular tests. So those are your PCR tests that detect the genetic material of the virus. And the shades of gray and black are tests for antigen that detect that protein component of the virus. So on this horizontal axis here, this represents time. And right here, this represents the time that a person has been exposed to SARS-CoV-2 virus. So this is the time of exposure. Now you see from the time of exposure, it takes some time. So as time goes on, we start now to see the RNA of the virus start to increase in quantities, it peaks and then drops off. Now for the antigen or that protein component of the virus, again, there's this time window before things start to build up, and then the protein, these antigens increase in quantity and then drop off. And then over time, as the disease progresses, and as the body has time to mount an immune response, then we start to see the levels of antibodies, which there's different types of antibodies. So IgM antibodies and IgG antibodies, they start increasing in quantities over time. Okay, so how does this affect testing? Now, what we need to look at here is this window. And we need to understand that there is a window from the time of exposure to a certain time where none of these tests will be able to detect anything, because this just simply hasn't gotten to the levels. The RNA hasn't increased yet. The antigen levels haven't increased yet. So there's really nothing there to detect. So all 3 of these types of tests are very likely to be negative in this window. Now between here and here, this small time frame This is where antigen and PCR tests may have a different type of sensitivity. Between here and here, antigen and PCR tests are very likely to both be positive. However, in this small window, a PCR test may very well be more sensitive than an antigen test. And this is why we'll see later that sometimes PCR tests are used to confirm a negative antigen test. So based on this information that we have here, different testing strategies and interpretation of results are made. So before we go over those exact testing strategies, I wanted to cover a couple of terms, because these are terms that explain what kind of actions are taken based on either known exposures or test results. So quarantine keeps someone who is exposed to COVID-19 away from others. So someone in quarantine, they may be feeling fine. They may have even had a negative COVID-19 test, but they should remain at home and away from others for the recommended period of time. And isolation, on the other hand, isolation keeps someone who is sick or who is asymptomatic but tested positive from COVID-19 away from others. And this includes staying away from others in the same home. So when someone learns that they have COVID-19 and they go into isolation, they should notify their close contacts. And notifying their close contacts lets those close contacts know that they should quarantine at home and get tested. So here we'll go over a testing strategy for someone who's symptomatic. Now, symptomatic people can have symptoms such as fever, sore throat, loss of smell, taste, headache, nausea, vomiting, diarrhea. These are some of the signs of COVID. So if someone shows up to get tested and they have symptoms, what the physician will do is they'll first do a antigen test. So likely a rapid antigen test. If that antigen test is positive, then the conclusion is that this person is infected. In the case of a symptomatic individual, if the antigen test is negative, a PCR test will often also be done. And this is to confirm, because remember, we have that small window of time where a PCR test is likely to be more sensitive than an antigen test. So if the antigen test comes back negative, but the PCR test is more sensitive and comes back as positive, then the conclusion is that this individual is infected and should be kept in isolation. Now, if a symptomatic individual has an antigen negative test, and then it's followed up by a PCR test, and that PCR test is negative, the recommendation for what this person should do is going to be based on whether they've had a known contact or not. So if there was no known contact with someone who had coronavirus, then the conclusion is this person is not infected and they can go about their business as usual. Versus if this person has had a known contact with someone who had COVID-19, the conclusion is there's no current evidence of infection. However, it is required that this person quarantine. And the reason for that is when the antigen test and PCR tests both come back as negative, it's very possible that you're still in this window of time here, right? So after SARS-CoV-2 exposure, we know there's a window of time that we're not going to detect either RNA or antigen. So this is very important. Now, as far as testing in asymptomatic cases goes, if someone learns they have had a close contact with someone who has COVID-19, but they don't show any symptoms, they would still go and get tested. An antigen test would be done. And if that antigen test is positive, the conclusion is that they're infected and must isolate. If the antigen test is negative, that means, again, there's no current evidence of infection, but quarantine is required. And that's because there is a known contact with someone who has had COVID-19. And then our last case would be someone who's getting tested. They're asymptomatic, they have no symptoms, and they also have no known exposure. So this could be someone who, say, wants to travel and gets a test. So if it's positive, they're infected, and of course, isolation is required. But if they are negative, then the conclusion would be not infected. So far we've gone over a number of different tests, and they've all been on an individual level. But can testing from the surrounding environment provide useful information? So sewage testing has been successfully used as a method for early detection of other infectious diseases, such as polio. And it turns out that wastewater or sewage can be tested for COVID-19 RNA. And a national wastewater surveillance system has been initiated in response to the COVID-19 pandemic. And depending on the frequency of testing, sewage surveillance can be a leading indicator of changes in the COVID-19 burden in the community. So the data that's generated by the National Wastewater Surveillance System can help public officials to better understand the extent of COVID-19 infections in the community. Okay, so what are COVID variants and what is their impact on testing? So as viruses mutate, they have a chance, as viruses replicate, they have a chance to mutate. So the more a virus spreads, the more chance it has to mutate. Now, a virus can mutate and have some little changes, and many of them can have no impact at all. However, sometimes when a virus mutates, it leads to a new variant. Some of these new variants, they will have a type of advantage. So they could have some type of replication advantage. So some mutations lead to new variants. And every so often, a virus changes in a way that helps it survive and reproduce. And these successful variants can then become the dominant type. So multiple variants have already been detected of SARS-CoV-2. You may have heard of some of these on the news. The variants are named B.1.1.7, B.1.3.5, and P.1. So there's some kind of change in the genetic code of these viruses that gives them some advantage. And remember, the higher the number of cases that occur, the more risk of mutation. Okay, so scientists, they continue to monitor the virus and look to see what's circulating. And this is a picture of what's been circulating in the United States since January. So at the beginning of the year, we see that the predominant type of virus was B.1.2. But as time goes on, these are months, January, February, as time goes on, we could see that the viruses that are predominant in the population really change. So B.1.1.7 really starts to take off here. So scientists will continue to monitor these, and they put them into groups. So they categorize them either as variants of interest, variants of concern, or variants of high consequence. Now, luckily, currently, there are no SARS-CoV-2 variants that rise to the level of high consequence. And hopefully we never experience this. And this is why it's important that we don't give this virus a chance to keep replicating and mutating. So a variant of high consequence, if that arises, this would be a virus that demonstrates failure of diagnostic tests, or current diagnostic tests may not be able to pick it up. A virus that would be in this category could have reduced the vaccine could have lower effectiveness against it, or it could potentially cause more severe disease. Okay, so we've gone over different testing strategies, how we interpret those testing strategies, or how we interpret the results from those testing strategies, why it's important to really put the brakes on infection, because the more time we give, the more time and chance we give the virus to replicate, that gives it more time to mutate into something that could become even more harmful. So COVID vaccination and testing is important to keep your family and community safe. Because remember, if you get vaccinated, you can help stop this chain of infection, and that will really have a big impact on the outcome of these diseases. Right. So I do have one more slide. Where can you go to learn more information? Remember that not all sources of information are reliable. So, you know, we all have questions about COVID and even other health related matters. So where we look for the answers to those questions is very important. So these are some places that I would suggest as, you know, where you turn to when you need to get information about your healthcare. Okay, and then I would like to see, I don't know if I could see if I have any questions from our participants. Just give me 1 second here. Okay, I believe I've stopped sharing the slides. So I see some questions. Is COVID testing still recommended once you're fully vaccinated? If so, how frequently should we get tested? So thank you for that question. COVID testing. So if you are fully vaccinated meaning you've received both doses of the vaccine, or one dose in the case of Johnson & Johnson, and you're past that 2-week window after receiving your last dose of vaccine, then if you do come in contact with someone who is positive for COVID-19, it is not necessary to get tested. However, if anyone comes down with symptoms that are similar to COVID symptoms, whether or not you're vaccinated, then you should get tested. There's another question here. If I test positive for antibodies, is it safe for me to be around my family and others? So a positive antibody test could mean that you were either infected in the past or you're pretty well into an infection. So antibodies tests are not used to determine whether or not you are currently infectious. So those types of tests should be viral tests. Viral tests will tell you if you're currently infectious and if you need to be in isolation. Because a positive antibody test could possibly mean you had COVID, 6 months ago. So the antibody tests and the viral tests, you need to look at those viral tests in order to make the determinations as to whether you need to quarantine or isolate. So I think I'm coming to the end of my time here. And before I go, I just really like to thank everyone very much for your time and attention. And I hope this presentation has provided you with some useful information. And thank you to the meeting organizers for inviting me to participate in today's Health Summit. And thank you to all my colleagues at Siemens Healthineers who work every day to drive innovation to help humans live healthier and longer lives. Enjoy the rest of the Health Summit, and please stop by the Healthineers booth. Thank you. Bye.